So is it safe to say that the worst of COVID-19 is behind us? We've heard that that is the case. We do know, of course, though, that the fifth wave is coming sometime in winter, but currently numbers are low. And for the last 2 weeks, the test positivity rate has not gone beyond 10%. Hospitalisations, which is one of the most important metrics, still on the decline. And during his State of the Nation address last week, President Cyril Ramaphosa said there are plans to end the state of disaster soon. But days later, it was extended by another month. Well, let's discuss all of these issues with Wits University School of Medicine's Professor Sanne, who's also a Ministerial Advisory Committee member. Prof, thanks so much for your time. So the fourth wave is over, infections really low. The South African Tourism Business Council was on the show earlier this week. They're calling for the immediate lifting of the PCR test that is still required of tourists entering South Africa. Would you support a call for vaccinated travellers not to have to go through that test?
So good evening, Sally. Thank you very much for the invitation. A disclaimer statement to start. The Ministers' Advisory Committee does not commit the Department of Health to implement any of our advice. However, we have indeed come out from a technical working group of the Ministers' Advisory Committee with a advisory that went to the department on Monday, where for a number of reasons we have actually recommended that testing of inbound travellers to South Africa is discontinued. We advise this because of the substantive case rates that have occurred in region, particularly on the land border crossings. And indeed, the case rates in South Africa support that we have are one of the countries with the highest rates of COVID transmission in all of the waves of the pandemic. In addition, we advise this because we believe that the testing capacity that is being deployed at our borders is in fact should be deployed elsewhere, either in the staff in fact conducting vaccinations, which is the most important step to undertake now, or to direct testing capacity towards symptomatic cases where in fact we wish to make a diagnosis of COVID. So overall, the Ministers' Advisory Committee has advised to discontinue the inbound traveller testing at this time.
And as you say, that's advice that will go to the Health Department for a final decision. Is that for both vaccinated and unvaccinated?
Yes, so the differential of vaccinated and unvaccinated becomes a little complex because indeed, particularly within region, the decision or the actual vaccine certificates, the reciprocity between countries has not been established. But indeed, overall, we actually believe that the risk to South Africa of an inbound traveller bringing COVID to South Africa is low, and we have data to support that with large numbers of testing being performed. Then, if somebody is positive, the current isolation quarantine guidelines have been changed, and so in fact, what would happen if somebody presents at a border with a COVID test positive? We're not going to turn them away. We also would no longer quarantine those individuals or isolate those individuals. And so, in fact, it is somewhat pointless.
Right. I also want to speak to you about the South African Health Products Regulatory Authority today approving this COVID oral drug treatment. I'm going to definitely mangle it, but it's something like molnupiravir. It's mild to moderate illness that it treats, and it essentially can stop COVID progressing to severe and deadly forms of the illness. It's taken orally. It's an antiviral. Is this a potential game changer for the next wave?
So you did much better than I have. I've practiced this and still cannot get the name right. Molnupiravir. And in fact, so it doesn't stop. So it is effective in reducing the progression of COVID disease from infection to moderate infection and or hospitalization, but it has a very modest impact. So it is approved. There is, however, rapid review from the Department of Health that in fact does suggest that the drug should be it is registered. That's not their task. That's SAHPRA's task, but that it's going to be quite difficult to implement. It has to be taken within 5 days of the onset of infection to in fact have a very modest, and I remember the number 30% impact on disease progression. In fact, I actually think the publications came out, the final publication came out with a less of an impact than even 30%. But it shows a trend, and what it shows is that we're starting to see direct antiviral agents, direct acting agents coming to the market. In fact, this morning there was a publication on a new drug. It is in the New England Journal of Medicine space at this time, with a much greater effectiveness. So the question really becomes, how does one implement such drugs? How do we get these medicines to patients who contract COVID within that very first window period of 5 days, and then to in fact have an impact on disease progression and hospitalization. So at this time the drug is registered, but how to implement it is going to be quite some challenge.
But as you say, we're seeing more treatments coming online, more people are getting vaccinated, nearly 42% of adults in South Africa vaccinated. Obviously we still need more, but it all seems to be pointing in the right direction. So I want to ask you about a couple of other restrictions that are not only affecting people's lives but also affecting business. So we still have a restriction on gatherings, 2,000 outdoors, 1,000 indoors. This is stopping things like football matches having spectators. The other issue is, the masks that people feel they have to keep wearing. It's still mandated that we wear them. Are those issues also, have you given advice on either of those two issues or any others around the state of disaster that we're still in?
So the gatherings is moving forward in the technical working group at present. We hope to provide advice within the next 10 days or so. I do think that the higher the vaccination rates are in the country, the more the gatherings rules can be relaxed. So I know there's this fantastic optimism at present about the relatively low rates of COVID in the country, but indeed we do not know what the fifth wave is going to look like, and we do not know which variants are going to come towards us. So the real message is vaccinate. The higher the rates of vaccination are in the country, the more confident we can be to open the gathering space. I do think there's an overall sense to open the economy and increase the gatherings. The second one is the mask wearing. So mask wearing actually is beneficial for more than just COVID. Indeed, all respiratory infections benefit from this distancing and mask wearing that we have implemented. I do think, again, there will be, as part of the gatherings, there will be gatherings and masks as an advisory. I do think that we will be coming out with a clear statement on how to reduce those restrictions. But indeed, I personally believe that mask wearing is still very useful.
All right, well, thank you so much for chatting to us this evening, and some very encouraging news that the Ministerial Advisory Committee is recommending to the Health Department, who ultimately gets to decide, on dropping those PCR tests for inbound travellers to South Africa. And they're also discussing the size of gatherings currently. That was the Ministerial Advisory Committee member, Professor Sanne.